Guys, today we're going to talk about the brachial artery. What is brachial artery? Brachial artery is one of the most important deep arteries that supply to your arms and your whole of your upper limb. So, from where does brachial artery comes from? This brachial artery is a continuation of the axillary artery. The term axillary artery is given to the that part of the artery that is between the upper part of your ribs till your lower part of your teres major. So after the bottom part of the teres major, we call it the brachial artery that supplies your arm. Brachium means arm, so it supplies your arm and your forearm. So what are the parts of the brachial artery? So this is your main branch, that is a brachial artery, and it divides into radial and ulnar arteries. This is your radial, this is your ulnar branch. Yeah. So, and there are going to be let's talk about the other branches that exist at the arm. So this artery has one of its branch that takes a turn and goes behind the humerus. It pierces the intermuscular fascia and goes behind the humerus, makes a spiral, and again comes here. This is the profunda brachii artery. Profunda means what? Profunda means deep. In anatomy, the word profunda always denotes a deep structure. Profunda brachii artery. From this profunda brachii artery, there is a branch that leads to your deltoid muscle. So this branch leads to one of the branches in a profunda brachii artery leads to a deltoid branch. Because deltoid muscle goes and attached to the deltoid tuberosity, the humerus. So that part of the deltoid is being supplied by this deltoid branch. This is a profunda brachii artery. Now there are two other branches called the superior ulnar collateral artery, superior ulnar collateral artery, and your inferior ulnar collateral artery. This is your superior ulnar collateral artery. This is your inferior ulnar collateral artery. What do they mean? Nothing. Superior means it's the proximal part, right? So what happens is superior ulnar. Why do we call it ulnar? Actually, this ulnar nerve, this ulnar artery will take branches from here and anastomose are on the joint of the elbow. So ulnar collateral artery means these arteries will go down and they will anastomose with the branches of the ulnar artery at the elbow joint. So they are the major components of the anastomosis of the elbow joint. We will talk about it very soon, but let's first know about the branches. So profunda brachii artery. This is the main branch of the brachial artery. Superior ulnar collateral artery, inferior ulnar collateral artery, and our obviously our radial and ulnar arteries. So this we know. Now talking about the profunda brachii artery, they do give two branches. This is called the radial collateral artery, and this is called the middle collateral artery. Repeat with me. Radial or anterior collateral artery. This is your middle or posterior collateral artery. So what happens is, so as I said, this ulnar nerve, see this ulnar artery will give two branches called the ulnar recurrent arteries, and this gives a branch called radial recurrent artery. Recurrent means it's going back. You see all the arteries are coming like this, right? Recurrent means again going back to form the anastomosis. This is the ulnar recurrent artery. This is the radial recurrent artery. Should get a clear view, right? So let's revise it once again. This is the brachial artery, that is a continuation of the axillary artery after the lower part of the teres major. It gives its branches profunda brachial artery that along the spiral groove of the humerus takes a round around the humerus and again comes anterior, giving two branches, that is a middle posterior collateral artery and your middle posterior collateral artery and your radial, that is your anterior collateral artery. And again it gives other branches like your superior ulnar collateral artery, inferior ulnar collateral artery, and your radial and ulnar arteries which anastomose with the corresponding collateral arteries. So these collateral arteries that we are seeing here anastomose with the recurrent arteries. Repeat with me. The collateral arteries anastomose with the recurrent arteries to form the joint anastomosis. They are a part of the joint anastomosis. They form the major part of your joint anastomosis. So I hope the branches are pretty clear. And guys, there is another branch also that arises from your brachial artery. This is called the nutrient foramen. Nutrient foramen, it's very important because this is the artery that supplies your whole of your humerus, and you know humerus is a major long bone that involves in growth of your upper limb. So the arteries from your brachial artery called the nutrient artery supplies your humerus bone. So I think that's pretty clear. Other points are there, like their profunda brachial artery actually travels along your radial nerve, along the radial groove. Radial or spiral groove is present at the posterior part of your humerus, and along the radial groove both your profunda brachial artery and your radial nerve passes through. So what are the clinical significances of brachial artery? This artery is very important. So it can actually be felt near your biceps tendon. So if you try to palpate or feel near the medial part of your biceps tendon, you will be able to feel your brachial artery beating. You must have seen in some cases the doctors used to put the stethoscope on top of your elbow, right? So that is to feel the brachial artery's pulse. This is one clinical significance that is used in recording the blood pressure as well. In other cases, how do I explain? While we are checking BP, they used to wrap around the BP belt, right? So when they tightly compress, and immediately after they are releasing that pressure, you will be able to feel the heartbeat, right? It is from the brachial arteries. So by that you can actually feel the brachial artery pretty well during taking the blood pressure test. Second, rupture of the brachial artery, that is a supracondylar fracture. A supracondylar fracture. What is a condyle? Condyle is a that part of the humerus that forms a part of the elbow joint. Supracondylar means above the condyle. So this place is also a frequently occurring place for fracture. So a fracture in this place could cause the brachial artery to rupture, causing a condition called Volkmann's ischemic contracture. I will send some images in the link description in the below. Walkman ischemic contraction is nothing but this brachial artery is going to supply your flexor and extensor components of your forearm. So this is the brachial artery. If the brachial artery is coming here, it's going to supply my flexor components. Now in the case of an injury to this brachial artery, your flexor components will not receive oxygen. So up to 6 hours, the muscles might survive, but it undergoes a process called ischemia. Ischemia is the muscles are slowly damaging and degrading due to the absence of oxygen supply. And after a particular period of time, your muscles will not be able to recover. They undergo a process called necrosis, causing your hand to become like this. So, in people with Walkman's ischemic contraction, they will have their hands like this, literally like this. They will have their hands due to the muscles are not being able to function properly. They will have the position of their hand like this, and their hands will be very irregular with lot of damage seen in their hands due to necrosis. So I hope I made it pretty clear. In another video, I'll be talking about the joint anastomosis of the elbow joint, which is again very important because this anastomosis occurs at the place called cubital fossa, where we do the injections and other stuff. So I hope this video helps. Make sure you subscribe, guys. Thank you. Peace.